Today's topic is, are egg retrievals painful? The quick answer is that generally speaking, egg retrievals are not painful during the actual procedure itself because of the use of sedation or anesthesia. Most patients may experience mild cramping, bloating, and spotting vaginally. Afterwards, it resolves within 1 to 4 days. However, the level of comfort during a retrieval varies significantly between clinics depending on the type of sedation that's used. Here at Markham Fertility Centre, every single egg retrieval is performed with a dedicated anesthesiologist, ensuring a fully pain-free experience at no additional cost. This is a unique approach in Ontario. Welcome. My name is Dr. Marta Wise, and I'm a fertility physician here at Markham Fertility Centre in Markham, Ontario, Canada. And I am the co-host of My Fertility Podcast. If you're here, you're likely navigating questions about your fertility, and you are not alone. My goal is to help you understand your options so you can move forward with clarity and hope. So what happens during an egg retrieval? An egg retrieval is a short outpatient procedure performed here at the clinic as part of IVF or in vitro fertilization or egg freezing. Here's what it involves. Your physician uses a transvaginal ultrasound probe or camera to visualize the ovaries. A thin needle is guided through the vaginal wall into each ovarian follicle. Fluid, which will hopefully contain the egg, is then aspirated from each follicle using gentle suction. Retrieved eggs are immediately transferred to the embryology lab, where an embryologist will examine the fluid to search for the eggs. This procedure in total takes approximately 10 to 20 minutes, depending on the number of follicles present. There are no incisions or stitches required. While the procedure is minimally invasive, the needle passing through the vaginal wall and into the ovaries can cause discomfort or pain depending on the type of sedation, ovarian position, the number of follicles, and an individual's sensitivity. What are the types of sedation that can be used for an egg retrieval? The comfort of your egg retrieval experience depends largely on how sedation is done. In some clinics, there is no sedation or only the use of a local anesthetic for an egg retrieval. This is basically the use of a numbing injection right into the vaginal wall. Now, unfortunately, there is moderate to significant discomfort that is possible with this. Although the use of no sedation or local anesthetic is quite rare in Ontario, but is used in some situations where patients may not be medically able to proceed with sedation. There is also the option of using conscious sedation or IV sedation. This means that there are medications that are administered by clinic staff to relax the patient during the retrieval and to reduce pain awareness. Now, mild discomfort is possible, and some patients will report pain with difficult to reach ovaries or ovaries that are high. Again, this is the type of sedation that is used in the vast majority of Ontario fertility clinics. The third option is proceeding with anesthesia with an anesthesiologist with deep sedation and the use of propofol. Now, in this instance, the full sedation is managed by a dedicated specialist in anesthesia. In this scenario, there is no pain as the patient is comfortably asleep throughout the procedure. This is used exclusively at Markham Fertility Centre, and we are the only clinic in Ontario offering this for every single egg retrieval. Now, the difference between conscious sedation and an anesthesiologist-managed sedation is significant. With conscious sedation or light sedation, patients are often relaxed, but they may still feel pressure, cramping, or even pain, especially if the ovaries are positioned higher in the pelvis or are difficult to access, or if the fertility specialist is performing a transabdominal retrieval. With an anesthesiologist present, the sedation is deeper, more precisely controlled, and the patient will experience no pain at all. So why does Markham Fertility Centre offer anesthesia at every egg retrieval? At Markham Fertility Centre, all egg retrievals are performed with anesthesia support from a dedicated anesthesiologist. This is included at no extra cost and applies to both funded and private cycles. This allows for a more comfortable procedure, as again, there is no pain during the retrieval. There's also reduced anxiety for the patient around the experience and a smoother overall treatment journey. Again, this is about optimizing the patient experience. This also allows for a more comfortable recovery. Anesthesia reduces the need for narcotic pain medications post-retrieval, and there are fewer side effects such as nausea, drowsiness, and constipation compared to narcotic-based pain management. also allows for a faster and more comfortable recovery after the procedure. In some patients, it also allows for much better access to the ovaries. Again, in some patients, ovaries can be quite high in the pelvis and are more difficult to reach. With anesthesia, when the patient is more asleep, the physician can more easily access harder to reach ovaries more comfortably and efficiently to get, hopefully, more eggs. In certain cases, transabdominal retrievals can be performed more easily when the patient is more asleep and more comfortable. This can improve both the safety and success of the procedure. The use of deep sedation is more inclusive for patients with specific needs. So for instance, patients with endometriosis, who may often experience heightened pelvic pain, will be more comfortable during this procedure. Patients with vaginismus or a history of painful pelvic procedures also benefit from deeper sedation. Some patients with a history of trauma or post-traumatic stress disorder, for whom a pain-free experience is critical, can benefit greatly as well. Patients with increased anxiety around medical procedures as well will benefit from deep sedation. Because we have an anesthesiologist present at every egg retrieval, patients who have other medical issues such as sleep apnea, asthma, or a higher BMI can be more safely managed in a more controlled environment when there is a specialist there whose whole job is to manage airway and breathing. This approach means that more patients can safely access fertility treatment, regardless of their medical or personal circumstances. So what can you expect after an egg retrieval? Regardless of the sedation type, some post-procedure discomfort is very normal. Patients may experience mild cramping, similar to menstrual cramps, typically lasting 2 to 3 days. Many patients will experience bloating because the ovaries are enlarged. This can persist for a few days, even up to a week. Patients may experience light spotting or even something akin to a light period from the needle puncture site. Mild sedation is also possible as the sedation wears off. Again, this is less common when sedation is managed by an anesthesiologist, but is still possible. Many patients will also describe feeling quite tired or fatigued and sleepy for the rest of the day. Most patients will feel back to about 80% of their baseline within 24 to 48 hours. Over-the-counter pain relief, such as Tylenol, is usually sufficient. You will absolutely, though, need somebody to drive you home after the procedure, and rest is recommended for the remainder of the day. You should absolutely contact your clinic, however, if you're having severe or worsening abdominal pain, heavy vaginal bleeding where you're soaking a menstrual pad in an hour and that's continuing for a few hours, or if you have a fever or rapid weight gain or very severe bloating, as these can be potential signs of ovarian hyperstimulation syndrome. So how can we reduce anxiety about the egg retrieval? If you are nervous about this procedure, first of all, let me say that that is completely normal and extremely common. But here are some steps to consider that may help. You should ask your clinic specifically about what type of sedation is used and whether an anesthesiologist is present. You should absolutely talk to your fertility physician about your pain tolerance and your medical history, any past experiences that you've had with procedures. You should also consider touring the clinic before your cycle to familiarize yourself with the environment. And of course, you should consider preparing for the day itself. Wear comfortable, loose-fitting clothing and arrange for someone to drive you home at the end of the procedure. You should also clear your schedule for the rest of the day. Again, consider choosing a clinic that prioritizes your comfort. If a pain-free retrieval is important to you, confirm that an anesthesiologist will be managing your sedation with deep sedation. And this brings us to the end of our topic for today. Is the egg retrieval painful? And remember, wherever you are in your journey today, I know this path can feel heavy at times, but you are not walking it alone, and there is still so much hope ahead. Please be sure to follow along our Markham Fertility Centre YouTube channel for more educational videos. Make sure to join me as I deconstruct our next topic on this YouTube video series.